everyone, and welcome to the Dr. Jody Show. I'm Dr. Jody. Today we're going to be talking about a debilitating condition, fibromyalgia. I mean, most of you have heard of this condition, and most of you have either seen or observed a friend, a beloved one in this condition, crying, living in chains, living in jail in their own body, and they're not able to be comfortable doing anything, okay? So we're going to understand what fibromyalgia is. So the first question is that when you have this condition, we're going to explain what it is as we go along, is you ask a very serious question is, what's wrong with me? Why isn't my body working right? Right? It's a question that every one of us asked or asks on a daily basis or asked in the past. These are the questions of struggling patients that come into our office. Every single day we see this, and it's very, very passionate. They are bewildered. They have endured expensive diagnostic testing and are exhausted from dealing with pain with no answers, no clear answers, okay? Now, before we go any further, this is a very important slide. I want you to pay careful attention to it. In order for us to, in order to effectively answer the previous questions, it is important to explain the important shift in healthcare since the 1990s, when President George Bush Sr. Signed a presidential proclamation assigning the 1990s to be the decade of the brain. And ever since, there's been an explosion in brain research, okay? And over $1.5 billion, okay, was invested into active brain research. It's a lot of money, and still. Now we are reaping the benefits of that research, brain-based treatments, okay? So we're gonna talk about this further. So fibromyalgia is a crippling disease. It's ruining millions and millions of lives every day. And the highest number is women, unfortunately, but that's what it is. We're gonna talk about this. And it does not get any better by itself. So if you have fibromyalgia, which is pain all over, the chances of you getting better on your own is very, very slim. It's not gonna happen. The Journal of Neuroscience, this is a peer-reviewed journal, reports that the longer you have fibromyalgia, the more your brain dies. Why? Because fibromyalgia hypersensitizes your brain. It makes your brain pain toxic, okay? And brain cells overfire and they die. They become hyperactive, and as a result of this hyperactivity or hypersensitization, more pain, brain cells die and you feel like symptoms increase, pain increases. 9.5 times the loss in normal aging. So if you have fibromyalgia, your brain is dying 9.5 times faster than normal aging. Scary, isn't it? Okay. Now, fibromyalgia has overwhelming number of symptoms. We're not going to go over each one of those, but you know, chronic fatigue, widespread heightened pain, and on and on and on. I mean, bowel disturbances. How many of you have this or have heard of anybody who has this? Or brain fog or fibro fog. You feel like people come to my office and say, Doc, I can't think. I want to say something and I lost it. I just had it on the tip of my tongue a second ago. More symptoms, okay? Impaired concentration, anxiety, depression. And this is debilitating. You can't do anything. You just sit and you can't do much if you're anxious and depressed. A sensitivity to lights. Some people come in and tell me, Doc, I can't open my eyes. I can't hear any noise, no stimulation. If my husband calls me, I'm irritated. It's just, it ruins people's lives, okay? And the symptoms go on and on. Frequent urination, heightened sensitivities, hypoglycemia, you know, fluctuation in blood sugar, which causes heart palpitations, you feel weak, you feel irritable, you shake, and on, and a lot more. The list of symptoms is so overwhelming that the diagnosis of fibromyalgia has been labeled wastebasket diagnosis. So the bottom line is, you go to your doctor, you tell him, okay, doctor, I have pain all over. I hurt. My shoulders, my arms, legs, abdomen, face, etc. Then he looks at you, he says, well, you have fibromyalgia. Okay, good luck. What do I need to do with that, doc? Just take some drugs and let's see how you do in 1 week, 2 weeks. And then the pain comes back, he gives you a different drug and the pain comes back. You keep changing all these drugs with no result, okay? The patients with fibromyalgia are desperately in need to know, okay, what's wrong with me, doctor? Tell me what's wrong. Is it fibromyalgia? Whew, thank you. At least I know what it is. But it's just a label. So if they tell you you have fibromyalgia, then what? It's nothing. Okay, but you feel good because at least you know what's wrong, theoretically. Okay? So most people don't know that all fibromyalgia means is that you have pain all over. You have pain all over and in your tissues. So fibromyo means tissues, and algia means pain. So it doesn't mean much more than that. That's it. So pain in your tissue. You go to your doctor, you tell him, doctor, I'm in pain. Tell me what's wrong with me. He looks at you and he tells you, you are in pain. So we haven't done anything, have we? So you go in pain and he tells you you are in pain. So, I mean, no diagnosis. That's why it's been labeled a wastebasket diagnosis. Does that make good sense to you guys? Okay. Now, beyond symptom management. So what we're going to be talking about today, and this is very, very important, is not about symptoms, guys. Because you can have, as we mentioned earlier, 20, 30, 40 things wrong with you. What do? You take a pill for each. You see a specialist for each. With all due respect to all the specialists, most of them are doing a great job. But if you go to a rheumatologist or a cardiologist or an internist or an eye specialist or whatever it is, okay, each one is gonna treat you in parts. All right, and each one is gonna tell you, this is what's gonna work for you. And the bottom line is that you get very, very frustrated, lost, and very irritable, and you become a prisoner in your own body. It's scary, okay? So the question is, why do these conditions remain unresolved? How come fibromyalgia is not resolved? You take drugs and after a little while, drugs don't work, right? You've heard this, huh? Friends, family who are in pain, okay? Because the underlying causal process is rarely, if ever, addressed. What's causing my problems, doctor? I don't know. It just happened. What do you mean? You know, just that's what it is. Okay? So the underlying cause is not being addressed. It's just, you know, the way things look on the outside. Chasing symptoms, ladies and gentlemen, is like chasing your shadow. Has anyone been able to catch his shadow? Never. There is no end. You run and there's your shadow following you. So you're chasing your symptoms. Maybe you control one symptom, but what about if you have 15? What do you do with the other 14? Okay? Then you are put on an assortment of medications. And you're all familiar with this. Huh? We're not going to go over these. You know, Lyrica, Zoloft, Lunesta, and others with serious side effects, ladies and gentlemen. Medications are chemicals, not nutrients. They are chemicals, okay? And chemicals have serious side effects. How is fibromyalgia diagnosed? Anyone has any idea? Besides you looking at the slide, okay? So, oh, cheating, okay. So you go to your doctor, okay? And this is the criteria. This is the, you know, the list they have. They look, okay, you should have a history of widespread pain, more than 3 months. All right, I have widespread pain. And a patient should have, or should feel, 11 out of 18 painful spots. So if you have 11, good luck. You have been labeled with fibromyalgia. Okay? Good. Okay? But what if you have 8 or 6? Then what are you labeled with? Subfibromyalgia? I don't know. Okay? What does that mean? Okay, so it becomes very, very frustrating because you say, doctor, only few points hurt. He looks at you, I don't know, take this drug. See how you do. Let me know in a week, or 2 weeks, or a month. It sounds familiar, doesn't it? Okay. Now, a serious question, or very serious questions, very, very serious. Every patient asks these. What do you do when medications stop working? I see this every day. Patients come and tell me, Dr. Jody, now I'm on 13 pills a day. 9 pills a day. None of them is working. What do I do? I have 2 options. I need suicide is one, and the other place is here. Would you be able to help me? You see this patient sitting in front of you, tears in his or her eyes. And they come with files that thick. Literally, I mean, I'm not exaggerating. And they come with bagfuls of drugs and supplements, and oh my God, what are you doing? Okay, so or they go to the doctor, and if they don't know what's wrong, they tell them, you know what, I don't see anything wrong with you. You look good. Maybe it's all in your head. Just get it out of your head. Fibromyalgia would go away. No, ladies and gentlemen, it's not in your head. It's a true neurological disorder, and we're going to get to that in a second. Or they tell you, or you ask a question, is it something that you have to live with? What do you think? Do you think you should live with fibromyalgia, like pain all over 24/7, 365?
No.
Do you think any human being deserves this kind of quality of life? No. Okay, we need to find answers. Okay, very, very good. Then you become a prisoner. That's it. You can't go, come, enjoy life, be with your friends, enjoy a meal, eat some. I mean, it becomes very, very crippling. Okay. The true causes of fibromyalgia. This is very, very important. I want you to pay careful attention here. True causes, huh? Okay, what are they? Number one, fibromyalgia is a neurological condition. Everyone got that? It's a problem in your processing of information, brain processing, okay? The latest research points to brain stem. We're gonna get to that in a second. Malfunction as a major cause, if not the cause. Brain stem in the brain, okay? Second, it is a functional disconnection syndrome. What does that mean? This means that connections between your brain and your body have been lost or impaired. Functional disconnection syndrome. Things are not connecting properly. So that's why you become hypersensitive. If anyone touches you, ouch, don't touch me. Because I get, if you touch me, I'll be 2 weeks in bed or something. I mean, it doesn't make any sense, okay? Setting off an electrical imbalance in the brain. Everyone get that? It's an electrical imbalance in the brain, okay? Triggering a whole cascade of pain and symptoms. Very, very important, okay? The third cause of fibromyalgia could be physical, emotional, or chemical stress. All right. For example, you fall, you get into a car accident, you are emotionally abused, or something happens, marriage problem, or whatever it is. Okay. This also affects your brain chemicals, your electricity, and it can set off a cascade of, it's a volcano of pain. Volcano. Okay. We're gonna look at these two pictures. The control center is situated in the brainstem.